this session. I'm going to go ahead and do that. All right, so the first thing we need to do is make mention of our funder and our funding activity. We are a SAMHSA funded grant project. That is the Substance Abuse and Mental Health Administration. We are a Region 5 grant project. There are, I believe, 10 regional projects occurring currently through about August of next year, although we have heard the good word that the RFP for the second year, which will be a longer 5-year extension of the grant project, is currently being written as of September and will become available in January. So we're very excited about that. Obviously, we feel like we're doing good work and we'd like to see that extend. So Region 5 covers the states on the little map you see there, which is Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin. As far as our funding activity, we provide virtual and/or on-demand education, evidence-based resources and research, as well as technical outreach to professionals working in and with rural communities. All right, so let's move now into our session and preparing ourselves to listen and engage in the session content. Before we begin, we want to just take a moment to promote the use of affirming person-first language when discussing behavioral health disorders. As we create an environment of learning together, we want to feel that welcoming and safe environment for everyone. So let's work together to manage a space that is supportive of non-stigmatizing, recovery-oriented language that we can help to reduce any negative bias and promote engagement. As always, we invite you to learn about successful prevention, treatment, and recovery from whatever space you are joining us from today. And we welcome you formally into the Great Lakes ROTA-RC community of learning. I'd like to introduce you now to today's presenter, Lieutenant Mike Blaser. The lieutenant currently serves in Janesville, Wisconsin Police Department and has been active in law enforcement for the past 25 years. Over the course of his career, he has specialized in over 4,000 hours of training in tactics, leadership, crisis intervention, patrol response, and trauma intervention. He's a certified instructor for the Mercy Health System in Rock County, Wisconsin. He specializes in communication, de-escalation, CRAES, RTF, and trauma intervention and preparedness. Lieutenant Blaser educates across the U.S. to home and international audiences on crisis intervention and has been working with local first responder communities to understand and address stress management, compassion fatigue, and resilience. With that, I would like to hand you over to our presenter, Lieutenant Mike Blaser.
Thank you so much for that, Amanda, and just welcome everybody to the session today. If you got in early enough, you heard some fairly light conversation, and hopefully that will keep things going today. We'll try to keep this as light as possible. We are going to talk about a fairly tough topic, so as we work through the morning, I'll try to keep it light. First thing I want to start with is this is a little bit different style PowerPoint than many of you are probably used to, so you won't see a lot of words on the screen. Beyond this, it's mostly going to be visual stimulation to help you associate something with the content we're talking about. The next thing I want to mention is that there will be some graphic content from time to time. Whenever we're talking about mental health and talking about trauma mitigation and things that cause trauma, there is an opportunity for some of these pictures to cause a reaction for people. So when you see this warning graphic content slide, I will pause for just a moment, give you a chance to look away if you choose to. And then I'll give you a quick example. So if you see the warning graphic content pulling up, the example you may see is something like this: domestic violence with somebody who has just experienced domestic violence as the photo. So that is our warning sign so that we can move through this and hopefully not traumatize anybody by some of what I've told are maybe not such funny jokes that I laugh at. So you guys will enjoy that as well. So let's get right into it. What are ACEs? And let's move right through what ACEs are and talk about the basics of adverse childhood experiences. So when we look at the basic understanding of what adverse childhood experiences are, we're talking about those kids who are between 3 and 17 years old. They've experienced abuse, probably some violence at some point, And here's our warning for a little bit of graphic content. Look away if needed. Suicide in the home, family member who attempted suicide or died by suicide, or maybe somebody close to the family who's experienced that. Probably some drug use in the home, might be part of a family member. It could be the child themselves, but somebody somewhere through their home environment have dealt with drug use. Mental health is another one of those things that enters the home when we look at adverse childhood experiences, some level of mental health concerns with a family member that has been challenging for the home. An unstable home due to parental separation or household members being in jail or prison, financial things, that kind of thing. So one of the things that I look at from my position as a police lieutenant is, how are we going to teach our folks to understand ACEs? And we just did a very quick 3-minute overview of what adverse childhood experiences are. And when we look at this quote here by Takwon Soho, preoccupied with a single leaf, you won't see the tree. Preoccupied with a single tree, you'll miss the entire forest, right? And when I look at our young law enforcement officers, and just give you a little background here, we have 105 sworn is where we should be. We're a little bit short. We're running at about 90 right now, which means we've got 52 patrol officers, and more than half of them have less than 2 years of experience. So when I look at their life experience and what they have, what can I teach them? How do I show them what to look for? How do I show them that looking for a single leaf, they won't find the tree. If they look for a single tree, they'll miss the entire forest, right? Because those clues are there. And as we look at adverse childhood experiences and how they impact not only what I do, but what so many of you do, whether you're in social work or healthcare, therapy services or counseling, whatever you're doing, these issues are part of the entire forest. And we need to understand from the law enforcement perspective, how do we teach our folks that? So when we look at ACEs, there are 3 very specific categories that we have to look at. And if we delve a little bit deeper, hopefully my goal is that we can teach our officers what ACEs they're looking for. It kind of goes back to that age-old saying that you really don't know what you're looking for until you've found it. And once an officer sees it, hopefully they'll understand it. So as we look at these 3 categories, I want to really dig into what the nuts and bolts of those are, provide some examples for what this looks like. So warning, a little bit of graphic content coming up. So the first category we have to look at is abuse. What kind of abuse can we see in the household, and what are field workers seeing? Well, we have the emotional abuse, and defined by the CDC, it's a parent, step-parent, or adult living in your home who swore at you, insulted you, put you down, or acted in a way that made you afraid that you might be physically hurt. That's the definition that the CDC gives us. When we dig a little bit deeper into that, what does that look like for an officer? How do you interview a young child and help them express to you, what that looks like, what that emotional abuse looks like? The parent that constantly puts somebody down, you're not smart enough. I can't believe you're that stupid, comments like that. And teaching officers and field workers in general how to interview to elicit those conversations, elicit those comments from young children, to explain, hey, I'm hearing this on a regular basis. It doesn't make me feel good. It kind of makes me think that they're going to hurt me. So that's our first level of abuse. Next one is physical abuse. Again, defined by the CDC, a parent, step-parent, or adult living in your home pushed, grabbed, slapped through something at you or hit you so hard that you had marks or were injured. So the interesting thing is, a lot of times when we get called, when law enforcement goes out to a scene, or even brings a social worker to the scene with us, things get stabilized, or we don't see those injuries, and then we don't get a lot of cooperation, which is not all that unusual. So finding physical abuse, if they're visible injuries, that's an easy one. That's a gold star every day, right? It's the injuries that are hidden, or for those homes or families where they don't actually see the injuries, or nobody calls, or everybody in the household's afraid to call, and this continues for weeks and months. I'll give you a quick anecdotal story. I wasn't expecting this one to come up, but we had a woman report yesterday that she's been the victim of domestic violence for the last 12 years. Her children are 10 and 11, and they've experienced nothing but violence in their home for the last 12 years. And it's all been kept very quiet because that's how the abuser has kept things. And now we have the challenge of how do we uncover all this physical abuse, and how do we uncover it and prove it, because some of the reports are weeks, months, and even years old. So finding that physical abuse, and for those of you who are paying close attention, yes, I just recognized there was a typo there. So moving on, next one is sexual abuse. And we call this the secret because a lot of times sexual abuse stays very close to the vest for people. CDC defines it as an adult, relative, family, friend, or stranger who was at least 5 years older than you, ever touched or fondled your body in a sexual way, made you touch his or her body in a sexual way, attempted to have any type of sexual intercourse with you. So we know the definition of it, right? But the thing that we don't often get is we don't often get the report of it. A lot of times this stuff goes unreported for years and years, and we don't know that it's happening. That's why we call it the secret, because these things tend to stay very close to the victim's chest. They keep those things tight to the vest so that they don't have to report it. There's a level of shame and embarrassment and fear that goes with it. What if I report and they don't believe me? What happens if I go home and they didn't believe me? What kind of abuse will I get then? How much worse will it get if they find out that I reported and nothing happens, right? So there's a lot that goes into helping people who work in the field understand how to have a meaningful dialogue with a young person and get that information. Now, we have a process here in Rock County, which is in the southern part of central Wisconsin for people not from here. That we do these care house interviews, and I'm sure there's something similar in every jurisdiction represented here today. But that's a way for us to get into those conversations in a safe, meaningful way so that children don't feel threatened. So interestingly enough, excuse me, one of the things I want to point out is from 2019 to 2020, according to the FBI cybercrime report, crimes against children, cybercrime against children has gone up by 144% from 2019 to 2020. Some of the other numbers post-COVID are still coming through. So depending on which report you get from the FBI, we see different levels of that, right? So when we talk about the secret, right, and we hear that crimes have gone up 144%, I can tell you here in Janesville, give you a little bit of demographic background. We're roughly 65,000 people and change here in Janesville. We have about 100 sworn officers, 7 detectives, and they're taking cybercrime reports against children every day. We've executed 3 search warrants in the past month on homes where an adult was engaged in some type of cybercrime against children, whether it was downloading, producing, or distributing child pornography. And that's just in the last month. And we've gotten to the point of when we do these search warrants, some of these suspects know that if they get caught, they're going to prison for a long time and they become desperate. So the safety risk that we have has now gone up, not only for law enforcement, but for those other people in the home. Quick, entertaining, maybe feel-good story. Entertaining is not the right word, but a feel-good story. We did a search warrant just a week ago on a gentleman who had been collecting and distributing child pornography. Family wasn't aware. There was a lot of control issues in the home. It just so happened to be the day we did the search warrant that it was one of the children in the home's birthday. So our detectives hosted a birthday party for him after all the quote unquote business was done. Obviously not the greatest day in the world for this family, but detectives pulled together, got some money, purchased a bike, bought pizza, and a bunch of officers went down there and had a birthday party with this little fella and his family. So it's not all cops and robbers out there. Sometimes we actually get the chance to spend some time with people and help them recover from this, which is really what we're talking about here today, is that ACEs and trauma mitigation, right? And that kind of afternoon, as much business as there was to be done, there is a positive story there, right? And how we can start leaning into mitigating trauma for those adverse childhood experiences. All right. The second ACE that we look at in a deeper fashion. So we already talked about abuse. That's one category. The second category we're going to talk about is household challenges. You know, those things that affect the household in an extreme way, I guess I'll call it. So, you know, the first thing I want to look at is domestic violence. So when we look at domestic violence, the one definition I pulled out, mother treated violently. So definition is your mother, stepmother was pushed, grabbed, slapped, or had something thrown or kicked, bitten, hit with a fist, something hard repeatedly by father, stepfather, boyfriend, something along those lines. And the story I told you about 12 years of domestic violence, you know, that's an extremely challenging household. And mom believes that those children don't know anything. And I know once we get to a care house interview, those two kids are going to know way more than mom thought, right? So all those adverse childhood experiences are adding up every time that happens. So domestic violence, definitely a challenge for our environment, and one of those things that we have to lean into from a service angle. So as I'm explaining this, just keep in mind when we get towards the end of this discussion here this morning, we're going to talk about the mitigation efforts and how we lean into all these different processes, or at least crimes or adverse childhood experiences that kids see. Next one is substance abuse. So a member involved in drinking, use of alcohol, or controlled substances. So it'll be interesting. This is kind of a sidebar as the nation begins to open up laws regarding the use, possession, and distribution of marijuana, how this stat will change. But when we look at substance abuse in the home, again, we have a mitigation effort for this. We'll talk about, you know, how does that impact the children? And there is a significant impact. And when I look at the data regarding drug overdoses and drug overdose deaths, if you look at this chart, when we look at 1999 all the way to 2021 and start seeing that dramatic increase following COVID. So we've seen such a change since COVID-19. In 2020, roughly 91,000 and change overdose deaths in the United States, going to 2021, we're over 100,000, right? And the data for 2022 is still rolling in. The reason it's still rolling in is because it takes time to get information from the medical examiner and the coroner's offices around the country to definitively say what caused that death. But these numbers aren't going to slow down unless we start intervening at some point. But as you can see, as COVID-19 changed, drug use and substance use in households has changed. So we're seeing that as an adverse childhood experience. And we'll talk about some of the reasons that people get involved in drug use here a little bit later. Other things in the home, mental illness. So when we talk about a household member who's depressed or mentally ill, or even attempting suicide, and we talk about depression, we have to look at those numbers post-COVID, right? Because we're kind of on a trend here. And this isn't a presentation about COVID, but this is our world right now, right? So the prevalence of anxiety and depression has increased by 25% since COVID-19. So when we think about that increase, when we think about that change, we've had issues before with adverse childhood experiences and how it's affecting kids. As we continue to move through this century, we're seeing more challenges that are facing children in the home because depression's a thing. How many people were locked in their home and couldn't work outside the home? How many people haven't been able to go back to work because their anxiety is now such that they feel uncomfortable in the workplace? So we're seeing a change that from a first responder standpoint, when I say first responder, I'm not just talking police and fire, it's social workers. It's all of us that are here today. You know, we all have a piece of this pie that we have to work towards. So the next household challenge is divorce. Interesting statistical analysis on it. Divorce obviously affects the home because kids feel like their world is being uprooted and it's become unstable. So when we look at some of the numbers for divorce, 16.3% of women age 15 and over, again, this is according to the CDC, 16.3% of women age 15 and over were married in 2019 compared to 17.6 in 2009. So the marriage rate has dropped over that 10-year period. In 2019, 7.6% of those same women were divorced. That's of women total, and 9.7 were divorced in 2009. So kind of what it tells us is the number of people getting married is dropping, and the number of people getting divorced is dropping. So those numbers being said, we're still seeing divorce as a causative factor, you know, because it makes children feel unstable in the home. Incarceration, when we have a family that's been incarcerated, it causes significant challenges. There are things, you know, go back to that youngster that we did the pizza party for. My conversation back here at our police department has been, you know, that's a great thing we can do for them, but what's the long term look like? You know, that's really some of what we can do is we can offer a day sometimes, but what other services are we going to have to engage as we move forward? Because dad, who's in jail, is the sole breadwinner. Mom has never worked. They still got to pay rent. They still got to pay their bills, got to pay for school fees to get the kids off to school, put food on the table. So there is a lengthy challenge coming for that family that we've got to start engaging several of their services to help us with so that we can make sure they're sustainable in the community and mitigate those ACEs down the road. So the next category we'll talk about is neglect. So neglect in the household is a lack of support, whether that's emotional. So when we have somebody that's rarely supportive, doesn't make you feel important or special. When we have kids say they never felt loved, or people in their family never looked out for each other and everybody felt like they were on their own, that's that lack of support and neglect that we talk about. So other types of neglect that we see in the household would be physical neglect, when there's rarely someone to take care of you, protect you, or take you to the doctor if needed. You know, kids that are fending for themselves at, you know, a very young age, 7, 8, 9 years old, or kids who don't have enough to eat, or parents who are too intoxicated, be it by alcohol or narcotics, to take care of them because those parents were dealing with their own trauma and potentially using controlled substances or alcohol to manage that. So how many of you have ever, rhetorical question, how many of you have ever been in one of these environments? And I ask you, you know, what's it like in there? What's it smell like? What's it feel like? What's it like to walk over some of the filth and grime and feces and some of the other stuff? You know, what's it like to be in that environment? And we see these, you know, for people working in the field, we see these environments all the time. How many of you have ever been in a home like this where a young child you've never met reaches to you, even though you're a stranger, and says, hey, without saying a word, wants you to pick them up and hold them just because they know that you're going to make them feel safe? I've seen it more times than I can count, which brings me to another one of my stories, because I think it's important to understand lived experiences. And I chose this picture. These are not the kids that I'm going to tell you about, but had a call one evening of a house that was in pretty rough shape. The boyfriend had left and he ended up being the abuser. Mom had been abused so many times that she also abandoned the house before we got there. And the two children were there. They're roughly 9 or 10 years old, little boy, little girl. And again, this is not them. But we ended up taking them to the hospital. All they had on was their underbottoms. And I was the on-scene supervisor, pretty terrible environment. And when I got to the hospital to check on the kids, the nursing staff was, rustling around and trying to find them snacks. And they were sitting in this trauma bed together in one of the more private trauma rooms, holding on to each other. And they were all they had. And they held each other so tight. It was clear how fearful these kids were because of neglect and abuse and all the other things that go on. It's one of the rare occasions in my career that if I could have taken those kids home that night, I probably would have, because they just needed a safe environment. I'm happy to say we got them there that night, but it wasn't easy. And just the terror that you saw in their eyes and the relief kind of at the same time that they were out of that environment speaks mountains to what some of these young kids are dealing with, and why when we talk about adverse childhood experiences, my belief is that this is a cornerstone for making our community stronger. We're in the place we're in right now. We have to figure out how to start pulling ourselves out of it so that we don't have 2, 3, 4 more generations of kids who are experiencing the same things that some of our folks are dealing with now. So with that, one of the things that I'll suggest to you, if you haven't done a ride-along with your local law enforcement agency, give them a call and ask them if you can do a ride-along, and see some of what they're seeing. If that local law enforcement agency has an embedded crisis worker, I would recommend shadowing that crisis worker a little bit too, and seeing what some of these folks go through. And I suspect most everybody in here is attached to public service in some sort. So you may have already seen this, but if you haven't done a ride along with law enforcement, who is generally the first person on scene, the first person that gets called, because we get called for everything, I would recommend that, because that's when you're going to see things in their most organic state. Generally after we're there, and before sometimes CPS gets there, code enforcement or some of those things, there's a massive cleanup that goes on in some cases. So if you can, reach out. If you're in the Janesville area, you can always get a hold of me, and we will try to get you a ride along, just so that you can see kind of what our world looks like and see what our communities are really feeling. So it's not something you'll see on Fox News or MSNBC. It's kind of the real world here in Midwestern America some days. So what are the outcomes now that we've talked about all those ACEs, got into the specifics, right? And when I look at that last section, we're talking about, hey, what information we got to give some of our new grads, right? Because we're all getting new grads, whether it's social workers, therapists, or police officers. What do we need to teach them to look for, right? So they can find the tree in the forest. So what are the outcomes and results of untreated ACEs? Well, obviously they're all negative. Things that are linked to chronic health problems such as mental illness, substance use, especially in adolescence and early adulthood. That's not to say that somebody who has adverse childhood experiences is going to have a mental health disorder. It's not it at all, but more prone to it. They can also negatively impact education, job opportunities, earning potential. And in some cases, it's just about mitigating that on the backside of it. So when we look at how ACEs are impacting people, about 61% of adults surveyed have had some level of adverse childhood experience before 18. As a matter of fact, 1 in 6 adults report that they have 4 or more adverse childhood experiences in their life. So when we look at that number, there are 258.3 million Americans over the age of 18 currently in our country. And when we look at those numbers, that means 43 million Americans have had 4 or more ACEs, which means there has to have been some mitigation effort, right? So many of those people had mitigation efforts, but for some of those less fortunate families, some of those less fortunate children who don't have access to health care or mental health care, whatever it is, they're not getting that treatment. So when we look at mitigation, what are some of the benefits? So let's talk about just some simple mitigation efforts. So if we prevented ACEs across the board, right, which we know we can't do, we look at 1.9 million heart disease cases and 21 million cases of depression that could have been avoided. 21 million cases of depression. And where do we see that first? We see that in law enforcement a lot of the time, right? Everybody that's here today, you know, emergency departments, social workers, crisis workers, law enforcement, even fire and EMS see that. So we see those. Where else do we see the effects of adverse childhood experience? With narcotics, right? And we're going to talk about some of those top reasons people use narcotics. Again, not saying that just because you have an adverse childhood experience, you're going to use drugs, but more prone to it. So as we move through this, and we continue talking, we have to end the stigma related to ACEs and opioids. One of the things that I talk about all the time here is that somebody who is addicted to opioids or addicted to some sort of narcotic, most of the time doesn't choose that. And it's very easy for first responders who have been involved in this line of work for a long time to become kind of callous. It does happen that people get frustrated and they're like, well, they're choosing that. And this is where I explain that most of these folks not. So we're going to go through the top 10 reasons people become addicted to drugs, according to the Rehab Center. This was written by Brenda Munnerlin. She's an RN. She did the research at the Rehab Center of America. So again, here's some warning for some graphic content coming up, talking about the top 10 reasons people become involved in narcotic use. Number one, trauma elusion, right? This speaks to adverse childhood experiences, right? So if the number one reason out of the 10 reasons in the top 10, number one is trauma elusion, that's a coping skill, right? Number two is mental illness. So we see that especially when it's untreated because of limited access to care. Stress relief, especially for those folks that may not have, you know, food or heat or a safe place to live. Prescription dependency. Again, end up with an injury, a couple of things that you can't manage. You end up on a prescription pill. I know physicians who've been down this road, and it's challenging. Genetics, you know, we started looking at family history. Are you prone to potentially using narcotics because of your genetics, or being addicted just because you had some other reason? So then we get into the bottom five. Legal indulgence. I want to do this because I can. Experimentation. Want to try it because I heard that's like the cool thing to do. Pleasure seeking. You know, somebody who's just looking to, you know, quote unquote, get high because it could be enjoyable. Rebellion. Hey, I'm going to do it because you're telling me I can. And then social influence. You know, in some cases, there's a little bit of peer pressure to get involved, so people get involved. The thing I want to mention is that fentanyl overdoses, as we talk about narcotics, you know, fentanyl is part of that arena now. And I always ask, do people know that they're taking fentanyl? And the answer is not always. In many cases, they don't know they're getting fentanyl. They're buying pills, whether it's oxycodone or hydrocodone or something else that is actually some other form. And we'll go through some of the things that we see it, but cocaine currently is the predominant coexisting narcotic that we find fentanyl in. We also find it even in little old Janesville, Wisconsin. We find it in methamphetamine. We find it in prescriptions. We find it in rainbow fentanyl. These are pills made to look like other narcotics, done in rainbow colors. I found it in THC gummies. And then we have to get into this ugly animal, trank dope. So this is xylazine being mixed with fentanyl. It creates a high that's very similar to heroin. Oh, and by the way, it's Narcan resistant. So the Narcan will treat the fentanyl, but it won't treat the xylazine. And just give you an idea of how narcotics are impacting Janesville. This is 2022 for us. These are our overdoses by substance. And you can see we're around that 20 mark for fentanyl overdoses. Heroin overdoses are down around 14. The previous year in 21, we had 60 heroin overdoses. And it was like a light switch. Things turned overnight. Some of the other substances on this sheet, cocaine, hydrocodone, Percocet, oxycodone, methamphetamine overdoses, they're listed as meth overdoses or cocaine overdoses, but in many of those cases, the patient was revived by Narcan. And I think we all know here that Narcan won't work on meth or cocaine. And if somebody's being revived from agonal breathing and being unconscious on Narcan, we know it's opioid based. So again, it's a data issue. So when we look at the comparison, 80 overdoses and 20 of those were fatal. So about 25% of our overdoses were fatal here in Janesville in 22. As we look at some of the numbers from the Rock County Human Services Department, when we look at the rise in fentanyl related overdoses, we see a significant rise in 22, and non-fentanyl, we see a significant sharp decline in 22, showing us that fentanyl is there. So you've heard me mention Narcan. My question to you is, are you carrying it? You absolutely should be. And I hear this from first responders from time to time that, well, paramedics will be there, I shouldn't carry it, or I don't need it here because I can call the hospital. Well, what if it's one of these little shorties? You know, somebody that got a hold of fentanyl by mistake because it was in a pill that mom or dad bought. So if you're not carrying Narcan, I would recommend getting Narcan into your first aid kit of some sort and just keep it with you, because you really never know when you're going to do it. And so many people don't know that they're getting fentanyl or getting some version of an opioid that they didn't ask for. Lots of stories here about people smoking marijuana, or there's a guy, refer to him as Good Time Charlie, who took cocaine every Saturday before he went out to the bar. Early in this year in 23 in February, he hit the floor and ended up in the hospital, woke up to us. And he asked how we got there. And we said, well, we revived you by Narcan. He said, but I don't use heroin. I'm like, well, you use something. And he admitted to the cocaine use, and it had something else in it. So it does happen. All right. So other places that we see adverse childhood experiences showing up in something that we refer to as any mental illness. And again, just because you have an ACE doesn't mean you'll have an AMI. But what are AMIs? Well, it's all of these things: anxiety, phobia, stress, panic, depression, PTSD. You know, these are the types of things that we look at when we talk about any mental illness. And I want to talk about the stats related to AMI because it kind of plays into this whole effort that we have to be involved in to mitigate adverse childhood experiences. So we have to mind stats because they make our efforts legitimate. Now, I'm not like a numbers guy per se, but when I'm trying to provide legitimacy to our efforts, we have to have numbers and we have to be transparent with them, right? Because so many areas of what we see, or all the different stakeholders I work with, we don't have enough transparency. So when I look at the National Survey on Drug Use and Health, it defines mental health services as having received inpatient or outpatient treatment, counseling, some sort of prescription, something that helped you with your mental health disorder, with your AMI. So in 2020, there were roughly 52.9 million adults with AMI, and only 24.3 million, so 46%, received services. 46% of people suffering with AMI in this country received a service. So that means 1 in 5 suffered from that. And young adults 18 to 25 have the highest prevalence of AMI of any other population in the country right now. 30.6% of 18 to 25-year-olds are suffering from that, which just happens to be one of those primary demographics for use of opioids. So if 46.2% of adults with AMI are receiving services, that means 53.8% are not. So in Rock County, that means roughly 13,600 people are not getting services for their AMI. So when I give you those numbers and we talk about only 46% being treated, what kind of a grade would you give, you know, the country as a whole for treating mental health? If there's any state legislators on here that can help, you know, maybe drive this, the grade's an F, right? You know, we're only treating 46% of people in this country that have an issue with AMI because services are limited. You know, there's just not enough people to get help. Currently in Rock County, Wisconsin, to see a primary care physician, the average wait is 3 to 4 months. And to get into a psychotherapist or some other mental health provider, you could be looking at longer depending on the organization that you contact. So what's the impact on our communities? Whoop, too far. So when we leave something untreated, it falls apart, right? When we don't treat people, things tend to fall apart. And law enforcement is dealing with these calls more now than ever because other services aren't available. And then we see reactions in the community. So we use a records management system called Spillman. These are just some of our numbers, just to give you some illustration of what we see. So if you look at the top of that, where it says wealth, that's welfare check. Janesville PD had a little over 3,022 welfare checks alone, 80 drug and alcohol overdoses, and 37 emergency detentions. Now, those numbers, I will tell you, are not entirely accurate. And it's not because they're being hidden, it's because the coding system we use takes effort. And, you know, we have 100 officers here that have to code things correctly. And we have roughly 70 call types that we enter into this. So it's just a coding issue. And when you look down at some of the other organizations, some of the other police departments, you see their numbers are lower. And again, it's a coding issue. But when I look at the numbers year to year, we are seeing an increase. Even if we're coding them wrong, or not coding them entirely the way we should, we're still seeing an increase, which shows that the health of our community is still changing. So when you look at calls for service related to welfare checks, we still see an increase as we go from 22 to 21. So more graphic content coming, just brace yourself, nothing awful. But there's some grim facts facing law enforcement. COVID-19 has changed the landscape. It's changed how we do things. It's changed how the human services industry works with all the other departments. We have untreated and unrecognized mental illness in all of our communities because of limited care, limited access to care. Where we're seeing it is in welfare checks, drug use, overdoses, domestic violence, and yes, a little bit of graphic content coming. Nationwide, we're seeing it in active shooters. And I don't want to make this presentation about active shooters, but I'll talk briefly about this towards the end about how active shooters are impacting the nation and how adverse childhood experiences play into that. So what's important now? Let's get into the mitigation efforts, things that we do here that I think once we build a roadmap can help. So got to leave a trace, right? Have to leave a thumbprint on every person we interact with. And this requires officers to have enough time off the job, social workers to get enough rest in between shifts, for people who are serving the community to have enough mojo left, right? A little bit of Austin Powers there, a little mojo to get us through our day so that we can impact somebody in a positive way, leave a trace on them. So best ways to overcome some of these obstacles. So the CDC provides 5 different strategies for overcoming adverse childhood experiences. Number 1, strengthen economic support to families who are struggling. And I think there's some obvious reasons why we want to add economic support, you know, creating jobs, transportation to get folks to and from jobs so they have access to health care. Promote social norms that protect against violence and adversity. And I'll talk about some of the programs that we use that help with that. Ensure a strong start for children. This comes from early education, intervention of services very early on, right? When these kids are 2, 3, 4 years old and seeing violence in the home or neglect, we have to intervene, leave that thumbprint, and ensure that they get a strong start. We have to teach them skills to cope right away, right? We have to have that positive influence and connect with youth in a caring way. You know, let them know that just because there's a badge in the uniform doesn't mean that we care. You know, we're actually here to help. And every service provider has that ability. We have to intervene to lessen immediate and long-term harms, right? So we have to have a connective process from law enforcement to human services to make sure that we can make that change. So this intervention that I've talked about, this starts with young police officers. This is a group that we hired about 18 months ago, taking an oath, standing on the front steps of the police department, taking an oath that they are going to be the first ones on scene. They are going to intervene. And some of those kids look pretty young, and we're going to ask them to solve our most challenging problems in our community. So we got to fuel them with the education. So what are the actionable items that we're talking about as I keep talking through this mitigation of ACEs and how we make this work? Number 1, there's got to be training. We have to teach our young field responders, social workers, therapists, CPS, code enforcement, folks are in these homes. We have to teach them what to look for. We have to train them on what adverse childhood experiences are. We have to teach them communication, have to teach them to talk with empathy, right? And empathy is an acquired skill, and speaking with empathy takes practice. It's easy to say that you're empathetic, but saying the words, hey, I have empathy for you, doesn't necessarily convey empathy. So we have to work on that. With that, we have to look at emotional intelligence. Are we developing our young people who are taking these public service jobs in a way to be emotionally intelligent enough to look past the initial problem, to look at the folks we're talking with and understand and feel what it is they're going through? We have to use something that I developed here called the Dynamic Training and Policy Group, where we evaluate policy, training, and equipment to make sure that we have all the things that we need here. Are we using our policies correctly? Do we have equipment? Do we have training to provide the right outcome, right? And if we don't, then we have to change it. But that comes from, and this is a fault in law enforcement, when a shooting happens somewhere around the country, law enforcement from all over the rest of the country looks at that and they say, well, I would have, right? We all have a great answer, right? Instead, what this program does is it tells us to look inside. If that same set of circumstances happened here tomorrow, what our policy, training, and equipment support that we did it the right way? And it doesn't have to be a shooting. It can be an investigation into a CPS case. Opioid fatality review. We have to have a review committee that goes through how are these things happening. And I believe there's some folks from our OFR on the meeting today. And in every one of our meetings with the OFR, we hear similar things, not just from here, but from around the state, is that adverse childhood experiences are a thing, right? They're impacting this. One of the things that we created here, because data is hard to gather, is this overdose alert teams SharePoint. We call it OATS just because that's funny to me. Some of you may not find it funny, but it's an acronym that allows stakeholders, law enforcement, private hospitals, public hospitals to contribute to this data point so that we can issue alert notices that, hey, there's some bad dope on the street, so that we can issue a countywide alert, hey, it's not safe right now, please don't. Transparency, we have to be transparent about the results when we make changes, right? So if we're going to change a policy, we're going to change how we behave, we're going to change equipment, we have to be transparent about what that was, even if we're wrong, so that the community understands we're making those efforts. And we have to have public awareness campaigns regarding what the purpose of departments are and illustrate the collaboration. So one of the examples I use, because we see this a lot, is when we tell a family we're going to call a CPS. The first thing they say is CPS is going to take my kids away. Not the case, right? They're there to help. So just having those campaigns to understand that. And then campaigns about stopping the stigma. We have to have all of our folks engaged in stopping stigma around mental health, around adverse childhood experiences, around using services. Campaigns about one pill kills to hopefully keep people from using narcotics and going down that road. Increase accessibility and sharing of information through the use of countywide and statewide MOUs. Got to create processes so that we can breach HIPAA on occasion. And I've found workarounds within the federal code 45164 when necessary. Doesn't violate it, but we found ways to make that work. We have to standardize responses with our stakeholders, which we do a good job of. We bring all of our stakeholders in when necessary so that we can respond to a problem as opposed to reacting. So having this level of response so that people can be engaged in the problem solving is really how we start to make some connection with our community. Communicating with the schools, that's the next step that we're engaged in. And depending on where you're at, you may or may not have school resource officers in your junior highs and high schools, but those officers are there as counselors, as peers, as mentors, and enforcers on occasion. But those first three are really why they're there, which creates an open line of communication so that when we do handle with care, we can be more effective about making sure not only do we do the handle with care, but some sort of follow through happens with those kids who experienced an adverse childhood experience the night before, a domestic at 2:00 in the morning that we responded to and arrested dad, that kind of thing. So it's not just handle them with care today, but what's the next step? Making sure hospital staff are aware of programming the police department has. Here in Janesville, we host a countywide crisis intervention team meeting every month. I have one this afternoon where we get all the hospitals and services involved. And we talk about what's going on because we need these contacts so that they understand our program. I got a call today from a nurse who has an employee involved in domestic violence and needs to get that employee some help. And because we have that connection, we're able to do that. Strong partnerships with CPS and every other human services department. Police officers, especially young ones, they're hard charging, they're out there to do the police thing, but understanding that human services is a support network that needs to be leveraged, and we have to have communication with them so that they understand what's happening. If they don't get the reports, how can they know what we're seeing? And then we have to follow through with human services and getting reports and making sure that we've done our job on the law enforcement side, because we're usually first to make sure everybody else here today has that information when needed. So how do we sell law enforcement on this effort and make this work so that we continue to improve things? Well, we have to focus on the positive outcomes that come with intervening and mitigating ACEs. Police officers, social workers, fire EMS, I can tell you from experience, we see the same families over and over and over. I'm dealing with grandkids of teenage parents that were teenage parents when I first got hired. So I'm not that old, but figure a 15-year-old teenage mother who is now 30 and her 15-year-old is having kids. I mean, we're seeing that progression and we're out with those families. So if we can break that circle of life that just continues down that negative path, we can hopefully intervene and mitigate this by early intervention, right? Starting with those kids early and getting training to officers about how to document ACEs, who to forward those reports to, how to get help for these families so that they can benefit from trauma mitigation. And some of those benefits are having healthy relationships. All the things we see here, understanding, kindness, support, honesty, mutual respect, these are all things we can give to kids during mitigation, and hopefully they will see that come back the other way. We'll see better performance in school from kids when we mitigate ACEs, higher graduation rates, fewer mental health problems, because these are time consuming. Law enforcement can spend up to 18 hours on one mental health call. Less substance abuse, which cuts down the demand for drug dealers, right? Been saying for a long time, we don't necessarily have to arrest every drug dealer. We got to take the demand away. It's supply and demand on Wall Street. We would follow a business model, right? Take away the demand for it and we put them out of business. Fewer behavioral problems, less violence, which is really the goal, so our schools are safer. Fewer arrests for violent crimes. I know as police officers, we like to be involved in stuff. However, we would really rather see fewer violent crimes. That's what brings business to the community. It brings jobs to a community so that people can thrive and have that financial support they need. So less burden and cost from violence. What we see is quality of life, speed of efficiency, and cost for law enforcement going down. So what's the bottom line here? So the bottom line is we have to break the stigma. We have to break the stigma and stop saying things like we all have stuff, right? Because if we continue to ignore the ACEs, we continue to ignore things that are going on, and we don't lean into preventative efforts, it falls on deaf ears. If it falls on deaf ears, then we see opioid addiction, right? The number one reason people become involved, trauma elusion, right? We're talking about adverse childhood experiences. Seeing mom and dad go through all their trauma is traumatizing on those kids, right? So we can't let it fall on deaf ears. The problem with some of this, warning, some graphic content coming up. The problem with this is when we talk opioids, it doesn't seem to catch. When we talk adverse childhood experiences, it doesn't seem to catch all the time, right? Because there's a certain segment of the population, when they hear opioids, they think, well, that person chose that. They chose that life. Well, we know from Brenda Munnerlin that that's not the case, right? And unfortunately, Janesville is not Robb Elementary School in Uvalde, Texas, but Janesville lost as many people to fentanyl overdoses in 22 as died at Robb Elementary. And again, I'm not making the comparison because I don't want to minimize what happened at Robb Elementary in Uvalde, Texas. That is a horrible event, and there's no excuse for that outcome, right? But our communities are losing people every day, right? When I did the after action on the shooter from Robb Elementary, that shooter had more than 10 adverse childhood experiences just in what I was able to uncover. So I can tell you that there were a significant number of ACEs involved in that individual's life that person had some support network, something that could have pulled them away. It might have made a difference. A little more graphic content, because like I said, sometimes when we talk opioids and ACEs, it doesn't land. When we talk about drug addiction, we talk about social work, it doesn't land. But when we talk about kids, it lands. Nashville, Tennessee was probably our most horrific one this year. And when we look at the young kids that lost their life there, and we look at the number of opportunities that law enforcement, social work, human services, therapists, hospitals, educators could have leaned in, could we have mitigated this? I can tell you that here at Janesville Police Department, we have a domestic violence intervention team. We have a drug endangered children investigative team. We're sending some people to Kansas City, Missouri for some training next month. But we engage in all these efforts. So the DVI, the DTPG, and all the other acronyms I've shared with you, every one of those is a trauma mitigation effort to make the community healthier. And we've seen our crime rate here in Janesville go down over the last several years, and we're in an all-time low this past year. So I share all that because there is a way to mitigate. And as much as it pains me to say kids land, this stuff doesn't land until we start talking about kids. And every one of those people that deals with an adverse childhood experience and ends up as an adult struggling was a child at some point, and we have to lean into that. So that is the end of my presentation. And I'm right at noon. I think I'm right on time. And for those of you who know me, I can be a little bit wordy and generally go way over. Amanda, there I am. I am wrapped up. I will turn it back to you for Q&A, and we'll see what we get.
Thanks, Lieutenant Blaser. So we will create an opportunity for Q&A with Lieutenant Blaser here in a minute, but we do have a few items for those of you who do need to get going this afternoon and get on with the rest of your day. So a big thank you to Lieutenant Blaser. If you do need to get going, we'll provide an opportunity for you to give him feedback through evaluation. Before we do that, if you could please do me a huge favor. If you logged in with a link that was shared with you versus jumping on through through our regular system. So if you didn't come in through the newsletter, if you didn't come in through our mailing list, if you could send me your full name and email address through the website that's on up on the screen there. It's also in the chat. If you scroll through there, Christina will be a love and she'll put it in the chat again. That would be amazing. And we'd love to get you on our rotation. We also want to send you your certificate of attendance because we want to give you credit for being here today because we know your time is important. And we want to continue to send you opportunities to jump on and be part of more events like this. Lieutenant Blaser is amazing. We want to get him back in to do more things with us. So we want to make sure you get the opportunity to come back when he's back. The next thing we want to do is we want to make sure that you get the opportunity to tell us how much you loved this, how much it met the needs for you. So we're going to ask you to jump on to this evaluation link. Tell us how the event went for you. There's some questions there. It's super short. I promise. I don't like long evaluations. I know you don't either. So we appreciate you just taking a few minutes to do that. That will be the opportunity you have to let Lieutenant Blaser know how awesome you think he is, how great you think his puns are. I've already told him, so you won't hurt his feelings. Great. And then one last thing, we have more events coming We always do. It's a busy, busy summer. It's a busy year. Tomorrow, if you feel like you're going to miss us, we're back again tomorrow with Dr. Alec Ellswick. He's been with us before. He's back again. He's bringing a friend to talk about nutrition as a pathway to recovery. Those are the details. So please jump back on tomorrow morning and hear what Dr. Ellswick has to say with Dr. Norman Bergdolf. And then next week, we're back again for Compassion Resilience. We have two educators coming on. Both of those are UW-Madison hosted events again. So they've got some internal educators who will be presenting on that. Both prove to be amazing events. We hope that you'll join us. We're going to go ahead at this point, I should say, we're going to end the recording.